Hello and welcome everyone to today's Brown Bag. Thanks for attending this second OSN special event to celebrate the World Breastfeeding Week 2018. Thanks to those who are joining in the room and online as well. Today we are fortunate enough to have with us Megan Gayford, our colleague from Save the Children UK. We also have a special guest in the room with us today, which is Princess Sarah Zaid of Jordan. And we are lucky enough because she will give us closing remarks at the end of this presentation. I will now hand it over to our colleague Nora Obbs to introduce our presenter. Thanks.
Thank you and welcome everyone. So this Brown Bag session follows a webinar that we held last week. The webinar was open to all nutrition, but also non-nutrition colleagues in WFP, also open to other program and emergency colleagues. And during the webinar, we set the scene on breastfeeding and why breastfeeding is important for WFP. We reminded WFP's commitment to protect, promote, and support breastfeeding, in particular in emergencies, as an intervention that is key and that saves lives. We also presented how it's important to work with partners, and today we have invited a key partner in humanitarian settings, Save the Children, to talk about their experience in infant and young child feeding in emergencies. So we have Megan Gayford, our guest, who is the Senior Humanitarian Nutrition Advisor for Save the Children. Megan is the technical lead for humanitarian nutrition in Save the Children. She manages a large team of emergency nutrition specialists who provide technical and search support to Save the Children humanitarian programming globally. So we will hear from Save the Children on their vision and their strategy for infant and young child feeding in emergencies, as well as evidence, key updates, and we'll talk about field perspectives. So we have an overview of the challenges, the key challenges for IYCF-E, so infant and young child feeding in emergencies, but also successes. And we'll talk about the linkages that we can make with WFP programs in emergencies.
Hi everyone. Thank you so much for this invitation to speak at WFP. And thank you for the introduction as well. So I am the senior lead for humanitarian nutrition at Save the Children. I have been with Save the Children for about 3 years now, and before that I had quite a few years with different UN agencies and different nutrition roles, and actually started my career with WFP some years ago back with the Lao Country Office. So it's really interesting to see how WFP has evolved over the last few years to be integrating and tackling the issues around infant and young child feeding. I have a team that's based globally. We do have regional advisors for Save the Children based in Nairobi, in Dakar for West Central Africa, and we have a focal point in the Middle East region as well. On our team, we are fortunate enough to have a researcher who is dedicated to IYCF-E as well, and in London we have 2 humanitarian nutrition advisors and also a global IYCF-E specialist. So that's the composition of our team, and we also have a number of emergency nutrition specialists who are based with Save US around the world.
Protection team will guide her to a baby-friendly space, run alongside a child-friendly space. She'll find support.
So I'm sure, unfortunately, the video hasn't worked, but I'm sure that the link can be shared with the presentation. So this was an introductory video to the IYCF framework, which has been developed by Save the Children and UNHCR, and it forms one kind of key component of our external communication and advocacy efforts as well. We will touch in on the IYCF framework throughout this presentation, and I hope also in the questions and discussion section as well, because it really does highlight how can other sectors be involved in and contribute to IYCF. So a note on our organisation's efforts in IYCF-E. We now have our first strategy, which we're really proud of. It's been a huge effort since Save the Children started to really focus on IYCF and IYCF-E back in 2012. So I have up here our goal in this strategy period, which feeds up into our larger Save the Children ambition of 2030, of which one is around child survival. So our goal is for Save the Children as an agency to prioritise and meet the needs of infants and young children in emergencies, and also to provide critical thought leadership to the sector. So this acknowledges we don't just have a role in programming, but we also have a role at the global level in terms of supporting policy, strategy and capacity of our partners. So our strategy has 6 focus areas. I won't go through all of these in detail, but I will just touch in on 3 areas. So the first is on quality program delivery. So this absolutely is our challenge as an agency. We have a lot of resources at the global level for supporting IYCF, and our focus in this strategy period is really to translate that into quality programming in our country offices. So we're working with our country offices to support both the inclusion of IYCF-E in their responses, and also to equip them with the tools and frameworks that they need for defining a quality program. We're also looking at preparedness and improving our monitoring and evaluation methodologies as well. The second area is on capacity building. So over the past few years, we have developed a 5-day IYCF-E training for program managers, which we've been rolling out over the last 3 years. So we have funding from OFDA for this, for the rollout of the training. And this training is not just to Save the Children, it's for our partners and for the governments that we're working with as well. So in this strategy period, we're looking to take that curriculum which has been developed and try to see how we can make it as accessible as possible by different partners. So looking at different innovative approaches to capacity development, and also looking at coaching and mentoring as well, acknowledging that capacity development is not just limited to training. And the last area, in the interest of time, I'll touch on is our research agenda. So we have gone through a process where we've identified the top 10 research questions in IYCF-E, and at the moment we are conducting research on optimised relactation protocols in emergencies, of which we will be releasing this work by the end of the year. And we are also looking at kind of revisiting what are the most appropriate indicators to use in an emergency setting. And we will be convening a roundtable of stakeholders on IYCF-E assessment and monitoring methodologies later in the year, which we're really excited about. So related to the quality of our programming, we've also invested in the last year with our development colleagues in articulating what we call a common approach for IYCF. So it's branded as Nourishing the Youngest, and it's our IYCF programming approach in all contexts. So this approach looks at how do we support the 4 recommended feeding behaviours. I'm sure as nutrition specialists, this is not new information. So we're looking at the 4 WHO feeding practices, and also the underlying practices of maternal nutrition, which is very relevant to WFP, and also appropriate household wash practices. So we've spent a lot of time and effort in trying to say what actually is IYCF programming. And the way that we've come out of that process is to look at 4 different levels. So for example, at the national level, what actions should our country office colleagues be taking around policy, legislation and financing for IYCF? within the health system, what are concrete actions that need to be taken to make sure that IYCF and IYCF-E is integrated into the health system. At the community level, we're looking at different approaches for SBCC and also community capacity strengthening. We had a lot of conversations in this process around what is the difference between IYCF and IYCF-E, and a lot of that battleground actually took place at the community level because we acknowledge in an emergency setting, our traditional social behaviour change strategies are not as appropriate. So we see in here in the approach the delineation at the community level between actually strengthening capacity versus in an emergency setting where we would be more looking at actions to engage the community. And the bottom tier is the individuals within the household. So how can we protect, promote and support infant and young child feeding in an emergency context through direct and indirect interventions to a mother, her child and the family around her. So I think it'd be interesting later on in this presentation for your reflections on how WFP's actions and interventions fit into these 4 levels, so particularly around the individuals within the household with WFP's interventions at the community and also at the national level. This approach is available. I have a couple of summary handouts as well if you're interested to know more about this approach. Okay, so now I would like to spend some time talking about our actual experience in different countries. So we are implementing our IYCF-E activities quite widely in different contexts globally. In this presentation, I will just focus on really 2 examples. The first being the work that we're doing at the moment in northeast Syria, in the Al-Raqqa governorate. So in this area, Save the Children has had child protection and education programming, and just in the last year, we've added a health and nutrition component. So for the IYCF-E intervention, we're looking to increase the access, of course, to IYCF support services for the target group. We're looking to use the IYCF entry point to also improve the access and the coverage of other nutrition interventions, which are led by other actors in this region. And third is a communication, a coordination, and a capacity element for our other partners in the area. So just to go into a little bit more detail, actually in terms of what this program looks at, we're looking at well, we have established mother-baby areas. So there's 10 mother-baby areas in this area, in this site. 10 mother-baby areas set around 4 different program sites. Most of those are attached to child-friendly spaces, but there is one example where we've actually integrated that MBA into a health service. And I'll touch on that approach later in the Bangladesh example. So within this mother-baby area, this is where IYCF assessments take place. And an IYCF assessment is it's a conversation, really, between a IYCF counsellor and a mother who has been referred to that service. So in this assessment, we take the time to really talk through with the mother how she's feeding her child, what type of issues she's experiencing, so that we can then formulate a treatment plan. This part of the treatment might be some further one-to-one counselling, and there's also some education sessions. The mother-baby area is also a space for other complementary services. So, for example, trying to meet the basic needs of that mother and infant in that particular context. So this will change depending on the needs of the population, but often we see things like nappies and baby wash that will also happen at the MBA. As I mentioned, it's also an opportunity for screening and referral for young children who may be malnourished, also referral of mums who may be malnourished, and also a space for more community mobilisation. So the MBAs become really the service point for IYCF, and then we have networks of community mobilisers who reach out into the communities of which surround the catchment area of an MBA. We also make great efforts to make sure that IYCF is included in our health services, because we know that, of course, particularly around maternity services, this is the first often the first contact point after perinatal care. So we want to make sure that our health providers are also sensitive to the needs in IYCF. So we do screening in waiting rooms of health clinics. We hope that we equip our clinicians to be able to identify feeding issues and then refer them to more specialised services at the MBA. And finally, on the capacity building. So we often, and in this example in Northeast Syria, we've set up a coordination mechanism around IYCF. Often this is called the Technical Working Group, which sits under the cluster. And then we identify what are the different training needs. Often our training really does focus on how do we control the distribution of breast milk substitutes. So we find that it is really critical in humanitarian contexts for there to be a coordination mechanism to make sure that the kind of monitoring and reporting of distributions of breast milk substitutes have a space for reporting and follow-up. And these are some of the photos that have come from the mother-baby area in Northeast Syria. So you can see that there's an example on the bottom right of support with basic needs. So for example, the baby bath and the one-on-one counselling. Okay, moving on to the second example, which is in the West Nile region of Uganda, which is the area where the South Sudanese refugees have been settled. This is an example of a kind of a broader nutrition program that Save the Children has, which covers, of course, screening and referrals for acute malnutrition, home visits for sensitization of IYCF practices, and to follow up malnutrition cases. So this is, I think, a really important example of how we integrate our services. So where there is a malnourished child, often there is also issues with IYCF. So making sure that we're not just identifying, treating the malnutrition, but we're closing the loop and making sure that there's sensitization on IYCF and referral for services where needed. Supporting the MBAs, we have mother-to-mother support groups, which are more groups of women where a lead mother has been identified. And we find that these are really helpful in terms of complementing the more direct services that we provide through mother-baby areas. So in the Uganda context here, we again have 10 mother-baby areas, and most are also integrated with the child-friendly spaces. So we're learning a lot about mother-baby areas and the best approach, and we do have a research proposal in the pipeline where we are going to be comparing different models of MBA so that we can then release some guidance on how we think different approaches of MBAs are appropriate for different contexts. But in the Uganda example, I have included some figures here just because I wanted to underline just the number of services that these MBAs are providing. In terms of the challenges in the Uganda context, we are facing a critical lack of funding. We are having to really advocate quite heavily to make sure that IYCF continues in this context. We're also grappling with the issues around separation from health services because they are tied to the child-friendly space. And this is something that we would like to look at in more detail in this research proposal about different methodologies. And then we are also looking at, in terms of the longer term in these sites, how can we support other sectors to integrate IYCF so we don't have this more siloed model. I'd also like to touch on the tech RRT deployment, which took place in Uganda. I'm using this example actually because it's the first example we have, or it's the first case of WFP requesting support from the Technical Rapid Response Team. And it took place this year to look at the IYCF-E situation, also in Uganda, but in the DRC refugee settlements. So this 8-week deployment of an IYCF-E specialist looked at the existing capacities and did a stakeholder mapping within the two settlements to look at, firstly, what's going well, but also to identify where are the challenges to other sectors integrating IYCF into their programs. And so what came out of this deployment is a package of key activities, specifically looking at WFP contact points. So into the WFP Food and Nutrition platform. So some of the outcomes of this assessment was for WFP to look at simple rapid assessments and referral to IYCF services. And just to highlight, a simple rapid assessment that's conducted by a generalist, not a IYCF specialist, just takes 5 questions. It's really just asking your mum, how's she doing? How is she feeding her child? Does she have any issues? And then making a judgment about what additional, if any, services and support that mum needs. So it's absolutely possible to do that within all contact points where you have a mother and an infant. In the DRC settlements, there's also a recommendation for WFP to look at social behaviour change, so looking at entry points and adapted appropriate messaging for IYCF, and then also how can WFP be involved in the monitoring and the control of breast milk substitutes. Okay, so taking a step back, I'd like to talk to you about where I think we're on track for IYCF and where we are really challenged. So we do have about 8-9 years now of experience from Save the Children in IYCF-E programming, and even since I came on board 3 years ago, I feel like we're learning an enormous amount about what works, but we have a really long way to go in terms of really understanding in different contexts where we should be investing our energy for the greatest impact on IYCF. But to break this down into different categories, looking at the pre-crisis strategy and policy context is absolutely critical. So does a country have the milk code in their legislation, and is it in force? We find this is incredibly important when we get to an emergency setting. Is there an IYCF strategy and policy that includes IYCF-E? So most countries that we work in will have some form of a MIYCN policy or strategy, but often it does not include provisions for what will happen when there is an emergency. So we really collectively need to be pushing on that to make sure it is included. And there's some very good guidance now that's come out in the revision of the operational guidance. And is there a nutrition preparedness plan in place? And we're also looking at Save the Children at releasing some guidance about how our country officers and other partners can be better prepared for IYCF-E. Moving on to leadership. So what we've learned is definitely if we don't have an active cluster, an active coordination mechanism, it's really, really hard to have a coherent, timely IYCF-E response. So we need to be advocating for an early activation of a cluster where it is needed. And I think to the Syria example as one. The level of commitment of government and other partners in IYCF, and then how sensitized they are to E. Again, I spend a lot of time in different country offices, and I find we're really still grappling with what is the difference between IYCF and IYCF-E. So we need to be having those conversations in country before a crisis. We also see that there's a real difference in terms of how timely our IYCF-E responses are, is there capacity to assess the needs. So we will, of course, try and get a couple of IYCF-E questions in a multi-sectoral assessment, but is there capacity to do a more in-depth IYCF-E assessment when it's needed? And is there just the national data and pre-existing secondary information on IYCF-E in place that would allow us to then design our response? The level of technical capacity on the ground is also a key factor. We now have the Tech RRT, as mentioned, but I think we collectively really need to be growing how we are utilising and fostering this technical capacity for IYCF-E at the global, regional, and then also at the country level. The last 2 points are that factors for success include the inclusion in the HRP. So we recently did an analysis of different HRPs looking at how IYCF-E was reflected, And we found that in 19 of 20 HRPs that were analysed, IYCF-E was there, but when we then dig down a little bit and we look at the activities and the indicators, we really then run into some trouble in terms of how much depth there is in the HRP and also how measurable that indicator is. And then, of course, we need funding. We need our donors to really sign up. We need to first include it in our proposals, and then we need to advocate to our donors that this is a life-saving intervention, and we need to be looking at IYCF needs from the very beginning of the emergency. Okay, moving on quite quickly, we also found that having an existing IYCF program in country is absolutely critical. So I refer to the example of the earthquake in Nepal, where we had quite a successful IYCF-E response, and I think the major reason why we were able to have a successful, timely response in Nepal was we had capacities that already existed from the Suhara national level MIYCN program. We need a trained workforce in IYCF. I think this is one of the biggest challenges that we have, particularly in a rapid onset emergency, is recruiting a cohort of staff who can then act as IYCF counsellors. And I'm sure no one is unfamiliar with the challenges of finding appropriate staff that can also speak the language. So we are really perpetually challenged on this point. As I mentioned, the sensitisation on E, this needs to happen before the emergency. And then we also need to have in place capacities to kind of really build capacities of other partners, particularly local partners in an emergency. So we look at this through the lens of trying to identify what exists at the national level before a crisis. So, for example, lactation consultant groups, which then can be recruited and mobilised in an emergency. In terms of programming, we definitely do find that it is a challenge to take our kind of IYCF-E programming as described in northeast Syria and Uganda from kind of a collection of service provision points through the MBA to something that is at scale. And the only way we're going to be taking our IYCF programming to scale is through sensitisation of other actors and inclusion of IYCF through a multi-sectoral approach. The non-breastfed infant, I think that is it's a brown bag talk on its own. I won't go into any detail, but I think more and more, and it's reflected in the revision of the operational guidance on infant feeding in emergencies, we really need to know what to do for a non-breastfed infant, even in contexts where we have very high levels of exclusive breastfeeding and continued breastfeeding. In my experience, once we have one non-breastfed infant, we really need a mechanism to support that infant and that mother. So I think there's a lot to be done globally on this point. Also around complementary feeding, which I think is particularly relevant for WFP, we are still really challenged on appropriate interventions for complementary feeding. So I think more and more the collaboration and the thought leadership from other global partners about how do we support complementary feeding in low resource settings, I think is important. And then finally, maternal nutrition. Again, I feel like we don't always get this right in terms of supporting the needs of mums. And then the final area is around mental health and psychosocial support. So this is an area that we're starting to look at in more detail. We did have a pilot in southern Syria, which unfortunately had to abruptly close because of the change in situation a couple of months ago. But we have to acknowledge that the mental health and the well-being of the mum has a direct impact on how she can feed and care for her child. So we really do need to include this in our programming. And finally, integration, which we'll be speaking in more detail about a little bit later in the presentation. Okay, Nora, you'll give me a break. Thanks.
Thanks. So thank you very much for highlighting the key challenges in IYCF-E programming. We've heard about insufficient integration of IYCF-E in emergency response getting the right technical capacity at the right time, low coverage of intervention, and maintaining a quality of programs at scale. So all these are challenges, and that speak to WFP as an organization committed in protecting, promoting breastfeeding and IYCF-E in emergencies. So we've looked at our numbers in 2017, and in the last year, in the 40 emergencies that WFP covered, we had about 40 million people receiving food assistance. And we can estimate out of these 40 million that 30.5 million are women and about 7 million are children under 5. So through our emergency response, WFP has a very large outreach to women and young children. And the types of activities, the major activities for food assistance that WFP undertakes in emergencies can all be used as platforms and be entry points for complementary services. So general food assistance, of course, is the largest type of intervention in an emergency, which includes also in-kind support or cash-based transfers, blanket supplementary feeding, also treatment of acute malnutrition, so targeted supplementary feeding and nutrition-specific interventions undertaken in emergencies, also asset creation and livelihoods, and social protection and safety nets. So we've identified that these platforms could be put at contribution. And if we look, so here from last year, the major emergencies, so 42 countries had emergency contexts. In nearly all of them, 40 countries out of 42, there was some type of general distribution, general food assistance. And in those 42 countries, 23 had nutrition-specific interventions. So we see that there are these emergency food and nutrition assistance platforms that can be better used. So the targeting principles of so that we use in WFP, so we target the most affected geographical areas, and we set criteria to identify the most affected households. So some of these criteria that countries use in emergencies are women-headed households, households with children under 5, households with chronically ill people, etc. And within also most affected individuals, women, pregnant and lactating women, children under 5. And our program modalities also, through our program modalities, by ensuring that distribution sites are in the community, the communities that are the most vulnerable, difficult to access. Also, WFP works closely with local civil society organizations, and we have more flexible modalities, working with scope. So we can use our program modalities for the benefit of IYCF-E in emergencies. So how does a country goes about integrating IYCF-E in its emergency response? We have the chance to have Diane Ashley here, who just came back from DRC. And DRC is a good example of how we worked closely with Save the Children. And Diane will talk about the example of DRC, and hopefully this will help also country officers how to go about it.
Okay, thanks, Nora. Yes, my name's Diane Ashley. I'm an emergency nutritionist in the rapid response team. I've just been in DRC for the last 6 months and came back at the end of last week. So in terms of some of the steps, it's an ongoing process, but some of the steps of how we're trying to integrate IYCF into the emergency response. First of all, earlier this year, a technical RRT consultant provided technical support mission to strengthen IYCF in Kasai as part of the emergency nutrition response. WFP contributed to the terms of reference for this mission. The mission lasted for about approximately 6 weeks, and we were actively involved in the various meetings and workshops that were needed as part of this mission. A key outcome was the development of an IYCF-E minimum response package, and that's something that can be used by the different stakeholders that are working in the emergency nutrition response in Kasai. Other steps, other things that we've done this year, the WFP DRC country office, they've prepared a funding proposal to support the scale-up of the emergency nutrition response, including activities to treat moderate acute malnutrition and to prevent acute malnutrition. And part of that proposal includes a very strong IYCF-E component. And we've just heard within the last few weeks that proposal has been, we've received funding from Food for Peace for that proposal, which is really very good news because it will give us the funding we need to integrate IYCF further into our emergency response. In terms of next steps moving forward, end of August, beginning of September, an IYCF training is planned in Kasai that will be led by Save the Children with WFP facilitating that. That training will be for government counterparts. It will also be for WFP partners and WFP staff. A pilot project is also, well, it's already being planned, is due to be implemented in Kasai, and that will receive quite a lot of strong technical support from OSN. And a mission later in August is planned to provide support to that. Okay.
Okay, so the IYCF framework really is a key resource for us now. It steps through what are key actions that can be taken for each sector to integrate IYCF into their sectoral activities. So I won't go into any detail, but I really would encourage you to have a look at the introduction video, which will be circulated, and also to have a look at this resource. There is a section on food security and livelihoods, but then also on protection and other relevant sectors for WFP. Okay, so in the interest of time, because I think we'd really like to have some questions and discussion around IYCF-E, I will just finish with what we have been up to in the Cox's Bazar response. So instead of giving an overview of what we've been doing, I'm just going to get straight into our collaboration with WFP. And I think this photo kind of says it all. This is our colleague Nikki Connell with Lucas from WFP, and they're at one of the food distribution sites. So Save the Children in this context is actually a partner of WFP for the BSFP, for the TSFP, but also for the GFA, which is not altogether usual for Save the Children. So you can see they're having a conversation here about how IYC, well, I'm not sure actually what they're having a conversation about, but they definitely came up with some really important outcomes for this response. So I was in Cox's Bazar shortly after Nikki, and I was at a food distribution site, and it's the first time I've ever seen there was a breastfeeding corner at the food distribution site for women, and there's a lot of learnings about how that worked, which I won't go into detail, but it's definitely worth us having another conversation about. There were also porters for women because it's an incredibly hilly, difficult terrain to move the food assistance about. So there were porters to help women return to their shelters. There was a separate line for women and children to collect their food. So it was a really good example very early on in the response of how WFP had integrated these they're not difficult actions, but they really make a huge difference. So I think Cox's Bazar has been it's been a great testing ground for how we work together on IYCF-E, and I think that this gave us some information. I think we will be moving in a really positive direction. Just finally, some key resources for WFP for your reference after the presentation.
So thank you, Megan, for your presentation, and thank you all for intervening in this presentation. And we can now open the floor for questions and comments. For those joining online, you can type in the box. You can either type your question, or if you can tell me if you want to take over the mic, and I can give you the floor and you can intervene yourself. So if there is any question in the room first, otherwise I can give the floor to Alison, who has a question already. So yes, we have a question in the room, please.
Thanks for the presentation. I just had a question for those on the line. My name is Ralph Siwiti, based here at OSN. On the Syrian example, in the mother-baby areas, you spoke about the need to control breast milk substitutes. Can you elaborate further on the actual challenges with this issue and what is being done to do that? Thank you. I think you can also touch on the same issue in Uganda. Thank you.
So, Alison, if you please want to take the mic and ask your question. Thanks.
Okay, thanks. Hi, Megan. It's Alison in Nairobi. Thanks so much for the presentation. Super interesting. I guess my question, since one of your examples, of course, was in Uganda and in everywhere we're working, one thing that we've seen is that in places where, ideally there's already nutrition programming going on by one of the partners, that we need to be very cognizant of national IYCF protocols as well. And one of the ways that we've been trying to work through that is definitely trying to work with UNICEF. And I think that's a piece that ideally needs to be there as well. You've got a lot of different partners that are bringing a different piece. I think the Save the Children UNHCR framework is so excellent for emergencies that have a refugee context. And in Uganda, we're going to be doing a training. And what's interesting is that it's a UNICEF emergency training in IYCF-E, but UNHCR and WFP and hopefully Save the Children are requesting that additional day be added at the end, where this multi-sector approach can also be included, because a lot of the basic things that UNICEF has in their IYCF-E framework is very much the same as you guys already have in your framework, with the exception of this multi-sector idea. So I just wanted to put that out, that I hadn't seen in any of the slides that went up very much about the other partnerships, of course, outside of WFP, but I think that WFP as an organization has a responsibility to make sure that all these different partners, that it's all harmonized and that we're not that we're not doubling up on what we're trying to do. Thanks.
Thanks, Alison. If there is any other question in the room, otherwise we can give the floor to Megan.
Yeah, great. Okay, concerning BMS management, so this is an issue that we have in almost all contexts in which we work, and we find that what is key is to make sure and to support government leadership around BMS management. So we find that the release of a joint statement can be very helpful in an emergency, which outlines the responsibilities, it outlines the commitments of the Ministry of Health to be enforcing the recommendations and guidance in the operational guidance. But we don't have a formula for this. I find from my experience what works is to have the people on the ground who can do the work in terms of sensitizing other actors I find that often in an emergency, people don't really realize the harm that they can cause by distributing breast milk substitutes. So we really need the boots on the ground so that they can talk to partners, they can follow up on distributions. And we also find that it's really important to have someone who's responsible from the government for the actual collection and warehousing, and then, if needed, destruction of BMS. So then there's a whole kind of logistics dimension to this as well. But yeah, I think key is the government leadership, it's the coordination, it's sensitization of other partners, and then it's also practical solutions in terms of the logistics for BMS. Is that helpful? Yeah. And Alison, I totally agree. I'm not sure if there was a question in there, but I think we're definitely on the same page in terms of this needs to be, this is not in the mandate of one organisation. This is all of our responsibility, and I think that we really need to make both concentrated and ongoing efforts to make sure that that collaboration and coordination at the country, regional and global level is in place.
Do we have any other question in the room?
Anyone's experienced that?
No other question from the field for now. Yes, we have a question in the room, please.
Hello. Thank you so much for your presentation. It was really interesting. My name is Adriana. I am born in OSN. I had a question, maybe it's a bit out of theme, but about fathers. I'm imagining an emergency context that maybe there's also moms that die during giving birth, and there might be children arriving without mothers in refugee camps. In the mother-baby areas, what kind of space is left for the fathers that arrive with their own newborn babies, for example? I guess this ties in also with the breast milk substitutes debate as well. Thank you.
Yeah, and that is such a great question, something we are talking about. We do have a pilot that's underway in Somalia looking at father-to-father support groups and the impact that that has, because we know, of course, it's different in different cultures and societies, but men play an incredible role in terms of decision-making. So we acknowledge that we do need to include fathers in these conversations. So watch that space. For the mother-baby areas, from my experience, it really depends in which context in which we're working about how appropriate and welcomed men are into that space. So we do have some mother-baby areas where culturally it is appropriate for men to be in that space. And also the community mobilization dimension as well. We shouldn't just be reaching out to women and communities. Men also do need to be involved at the community level, definitely. Great question. And maybe just also on the terminology, the mother, we kind of go back and forth about, is it a mother-infant dyad or is it a caregiver-infant dyad? And we had weeks of conversation on that when we were coming up with our common approach. And we do try and use the terminology caregiver because we acknowledge not all kind of mother-infants are together, and we don't want to have anyone feel excluded by our approach because we've been specific about mothers and infants.
Thank you, Megan. And I think in the interest of time, we can now give the floor to our special guest for the closing remarks. So Princess Sarah Zaid of Jordan, thank you so much for attending as well.
Thank you very much. I'm humbled to be surrounded by so much experience and expertise, and yet to be given the floor. So thank you very much for giving me this opportunity. The good news is that there is an effort, the rumblings of an effort currently at the moment, which is Save the Children, UNHCR, UNICEF and WFP to pull together an integrated approach, multi-sectoral, multi-partner around maternal and newborn health. And of course, nutrition and IYCF-E is absolutely at the heart of that. So, I'm very happy to hear your comments and the comment coming from Nairobi, because this is exactly why these rumblings are happening, and I hope that by the end of the year we will have a very solid piece of work that you will have all contributed to make sure that that we are using best practices, that duplication is ended, and that, as always, the woman, the girl, the child are at the center, and we are all doing our best around that. I've just come back from South Sudan and Uganda, and once again, as a non-nutrition person, I'm so grateful to all of you for your willingness to share with me your experience and expertise. I'm generally a very pessimistic person and a bit gloom and doom about the world around us, and going out into countries and seeing the work that you do in 6 months in DRC, your commitment and the care that you have for the women and the children is my ray of optimism that keeps me coming back. And now I have a question, actually. So in Uganda, in Arua, where the refugees are, we went to visit an integrated health facility that was WFP and an acronym that were running this really excellent place, and where they had seen very good results. It was actually about 54% Ugandans, and the rest were South Sudanese, and lots of delicious breastfed babies with very big, chunky thighs. Happy babies, happy mothers, showing up for a cycle of vaccines. It was really a wonderfully joyful place. They had a place for mother-to-mother, or sort of a women's peer support group, where to discuss issues like hygiene and breastfeeding and so on. And in actual fact, what the women wanted was to have their husbands involved, not necessarily to care for the children, but around family planning. And they said, I've got 4 children, I want to stop having children, what should I do? Are you sure you want to ask me? And it boiled down to their wanting to have a sort of a men-to-men peer group that would bring them into the fold, and so that they could actually access, and the family planning was available, but they couldn't access it unless their husbands were on board. And so that sort of integrated and flexible approach to programming. Other extreme, and this is where my question comes in Kamoja, is that where it was? Kamoja in northern Uganda, Karamoja. Really a pretty dire situation there, and talking to a woman whose child had malaria. So the child was about 1.5 years, was still being breastfed. Child had malaria, and the mother was pregnant. What is the quality of a woman's breast milk when she's already pregnant? And she hadn't eaten. This was about 3 o'clock in the afternoon, and she hadn't eaten since the day before. It's the reality of her life, and probably a whole lot of other women there. So she's not eaten since the night before, or maybe had anything to drink either. She's pregnant, baby sick, baby's nursing. What do you do? And on that cheerful note, thank you so much. But And I would love to have an answer. Thank you.
Yes, I think we find time to answer this question. I don't know who wants to.
I can respond to the quality question. So we have a fairly robust evidence that suggests that the quality of breast milk is protected until the point where a woman is severely compromised. That being said, is it fair? Is it okay to have a mum who is hungry, is tired, who is highly stressed, and then expect her to continue to breastfeed? I think this comes back to the question around what is our role? And I would argue our role is to support the mum so that the mum can then feed her child appropriately. And I think this is where we are missing a trick in some responses, is how are we providing support to a mum that's timely, that's appropriate, so that then she can care for her child. I think this is also the link with mental health and psychosocial support, because we know that women really suffer in emergencies. So where is the other mental health dimension? And we often find that this is a real gap in our programming.
Okay. So at this point, I think we can close this session. So thank you again, Megan, for flying all the way here. And thank you all for coming today and joining this Brown Bag session. Thanks to all of you who joined online. There were 25 people joining online today. And I just wanted to say that the Brown Bag sessions will now stop for the month of August, because the offices will be pretty empty. And we will start again the 6th of September with the first Brown Bag with UNICEF. And with this, thank you all again, and see you at the next Brown Bag.